Like it happens every Friday by this time at 9 o'clock. We've been raising awareness on glaucoma for quite some time right now. And every single day we scream it. You've got to take care of your eyes. Every single day I'm learning that my eyes is probably the most important part of my body, because if I cannot see, it's not just about my eyes, it's about mobility, it's about the ability to navigate life. And this morning on Glaucoma on Radio, we are confronting a silent but dangerous eye condition that has robbed millions of their sight, often without warning. You know, I have a friend who, a mother, and I know that it's not easy for her doing what she has to do. Your duties are not reduced, but then you are grappling with a condition. And she was not born that way, but boom, it just happened, and she lost it. Glaucoma has often been called the silent thief of sight because many people live with it for years without symptoms until irreversible damage has already been done. And while many of us casually say is not my portion, sometimes I wonder whose portion is it. The truth is that glaucoma does not respect optimism. It doesn't even respect your prayer points. It doesn't respect your ignorance. It will not say, because you hear some people ignorantly say, what I don't know cannot come to me. And I'm like, seriously? The real protection is knowledge, early detection, and timely action. So today we are asking a very important and personal question, which is, who is most at risk of developing glaucoma? Because if you're among those at higher risk, knowing early and checking your eyes regularly can literally save your sight. Now, joining me this morning is an eye care expert from the Eye Specialist Hospital, Enugu, as we break down the risk, the myths, and the steps that we all must take to protect our vision. We're excited to have Dr. Sohanyo Keke join us. Good morning.
Good morning.
Good to have you.
It's a pleasure to be here.
Happy New Year.
Happy New Year to you and our listeners.
And it's a year we have to take care of our eyes.
For sure.
All right. So to start with, we don't get tired of talking about glaucoma. We don't get tired of telling people what it is, especially on radio, where those who listened last week may not be exactly those who are listening. So there are always new people listening. So what exactly is glaucoma? And you might want to also tell us why they describe it as a silent disease.
Okay, glaucoma is a leading cause of irreversible blindness. It's a disease that causes blindness that cannot be reversed at all. So once
that's to say, whatever damage it causes cannot be reversed.
It is permanent.
It's permanent, okay.
But if you are identified early that you are at risk of developing glaucoma, or you have early stage glaucoma, there is a high possibility that you will live with your two eyes open. You can keep seeing. So it is important we catch this problem in good time. We call it the sneak thief of sight, or call it the silent thief of sight, just because glaucoma lives with you. Like in this room now, we are 3 of us here, and you don't know who is a victim here, and it is living with us here, and for some reason it is taking little by little your sight, but fortunately or unfortunately, God gave us two eyes. So the two eyes can see, and the way it is designed, the eyes can move left, right, up, down, even to the side. So when one eye is losing sight, and from the word go, glaucoma takes away your side vision. We call it the peripheral vision, what you lose by the side.
Okay.
And At the early stages, because you have a neck that can compensate when you don't see, you easily tend to look. So you often not notice that you are losing something. And the time you notice is when your central vision, that is, I'm seeing you head on, that vision is gone. You know that your sight has a problem. At that point, it has taken the whole chunk of your sight, because central vision goes last. So it takes away the central vision at the last part. Maybe 95% or more damage has occurred. That is the point at which most of the time our patients come to us and say, "Doctor, yesterday I woke up and I realized that I'm not seeing." But that may not be the real case. You have been losing this sight over several years. I saw 2 patients yesterday who said, "I was diagnosed of glaucoma 10 years back, 8 years back," and
They were diagnosed.
They were diagnosed somewhere at a screening, or one person was at a screening, one person was in a clinic, but
And they did nothing about it.
They were like, "I'm seeing, I am seeing." So, and so what the hell? The doctor said it, but I have used, and when you give a set of drugs for 1 month, 2 months, they believe that that problem has been sorted out.
Okay.
More so, your eye is seeing, therefore you don't really have to.
Now, they were diagnosed 10 years ago. And you probably don't know how long the glaucoma has been there before they were diagnosed 10 years ago.
Yes.
Oh, God.
So there are a lot of challenges. So it is important to understand that the diagnosis of glaucoma is not, we shouldn't wave it with a hand. It is something, when they pronounce the word glaucoma, or even if you are called a suspect, take it upon yourself. Just make sure once a year, go to the eye hospital, see the eye doctors, let them investigate you. It is not just good enough to look into your eye with an ophthalmoscope. There are gadgets. We use all the gadgets, because you might be looking as if you have glaucoma, but you may not have glaucoma at all. Such patients, we dismiss them clearly and tell them maybe after 2 or 3 years, come back for a checkup, because you clearly don't have it. Some, you see it.
Traces.
There are traces. You tell them, look, come for checkup. Sometimes you keep coming, 5 years down the line, you have not changed, but don't go into the pool. By the time you come back, we have a young patient who, I remember him almost on daily basis.
Like how old?
He was diagnosed of glaucoma in his 40s or late 30s.
Okay.
So he said, "It is not my portion. It is not my portion." Well-learned man, young man. And it's not my portion. By the time he came back 5 years later, and unfortunately, he has this aggressive brand of glaucoma. Glaucoma has so many variants. Some are very quiet. Even when you don't come, it doesn't move that way. His own is very aggressive, and he is almost gone, almost all. The one eye is totally blind as I am talking. The other one is 99% or more. So you can see a young man stumbling into your clinic. You will simply understand that this person would have preserved his sight if care was taken. What he did was to use holy water and prayed over it heavily with the help of his pastor. By the time he returned, he knew pastor's help was not sufficient. He came, but the medical help now is far from him. Even though you are trying to treat, you know that he even understands that a lot has been done. At that point in this, our environment, we still feel it is not part of our own problem. There is someone in the village, village people are being blamed for several things. Somebody is after me for a problem. Just know that the village people, if they have all their powers, they wouldn't be dwelling in the village. They would have been somewhere else. So it is good that we take eye care in our own hands, go to eye check at least once a year. I know economy can be biting, but there are times these facilities are all available. Sometimes you even have free glaucoma screenings available if you are so indigent. Just target the month of March. There is always glaucoma screening available at different eye hospitals, free of charge. You can go and get it done. Otherwise, please ensure, make it a point to visit an eye hospital, an ophthalmologist. Let them look into your eye and tell you what exactly is your problem. Maybe tell them that you don't have money, or you can follow it up. They will place you where you can come and access care. It's important. When you have this vision, you are still very rich because you have the ability to earn a living. You have the sense of independence. By the time your vision is lost, everything is gone. Even to see your own wife, your children, your husband, it becomes so difficult. To leave your bed, it becomes a problem. So you know that the gift of sight is a blessing from God. So just try to preserve it, protect it. We all need it until we are called to his bosom. So it's important that we take care of what God has given to us.
Okay, I guess we're talking to those who have not tested before.
Yes.
We're also talking to those who have tested,
Yes.
but who abandoned the pursuit of the protection of their eyesight, and then those who want to base everything on superstition. There are things you don't speculate. So we already have enough problem in this country. You don't want to add the loss of your sight to the equation. It will be crazy. Okay, so and we also see how religiosity, because I won't call it spirituality, religiosity affects people negatively. Who told you? Where did you get the notion that you can use holy water to cure? So we need to be serious. Okay, so let's get to the meat of the conversation. Who are the people most at risk of developing glaucoma?
Yes, a beautiful question, and it is important we address this. As we have said, glaucoma is a silent thief of sight. It is very important to identify those at risk. Now, age is an important risk factor. Those that are above the age of 40 and above, and in this part of our own environment, we encourage those that are 30 and above to come for eye checks, because glaucoma tends to be more prevalent as you age.
Okay. And
then the race, black race, okay, the African descent is 4 to 5 times at higher risk of developing glaucoma than the Caucasian, those European white race. So it's important that every African knows that genetically you have a problem. So it is something that is within your body, so you should take care of your eye. And then even amongst the blacks, Igbo race is more at risk. For every 1,000 people over the age of 40 that are screened, at least 59 will have glaucoma
among the
Igbos, compared to when you are talking about the Hausas. The Hausas, at least 17 of them will out of 1,000. If it is Yorubas, they will be up to 34. So you can see that the Igbos are at a high risk of developing glaucoma. We will still ask, why are the Igbos? It is not that you have been cursed. It is something in our gene. And the gene is something that has been implanted on you. For now, genetic engineering has not been that sophisticated to identify, and at birth they will give you, this is the gene that has been inherited by you. Maybe someday when we have all gone, they will give you that. We might be more equipped to handle that for now. So these are key risk factors we must understand: age, black race, and then if you are Igbo, you must attune your mind that I am at risk. So therefore, it is my responsibility to seek eye care early enough. And then when you come to family history, those that have family history, like in your family somebody was blind of glaucoma, sometimes you have a relative, far-flung relative that lived two or three generations past, but maybe it was not a near relative, so you couldn't really remember. But if you really think there was a relative that had blindness of unknown cause, please know that there was a history of blindness, and there is no harm taking yourself for an eye check, because family history plays a critical role. And in family history, we still come down to first degree relative. First degree relatives are your mother, father, brother, sister,
your
that we
family.
call it the sibling, and your child, the offspring. Now, amongst the first degree relatives, between siblings, the risk is higher. If your brother has glaucoma, you that is the sibling, the brother or sister, has between 3 to 4 times risk of developing glaucoma. If your parent has glaucoma, that is, my mother has glaucoma, the chance of developing glaucoma for you is 2 times. Then if you are the child of a parent, maybe you have 1%. So between siblings, the risk is higher. Then when you are talking about family history, your lifetime risk of developing glaucoma, that is in your own lifetime, is 22% higher than 22 times higher than somebody who did not have glaucoma. Like somebody who comes from a lineage of no glaucoma has like 1.3 times risk of developing, as compared to someone who has a relative with glaucoma, you have 22 times of glaucoma. So when you go for a glaucoma screening, you have a family history, you were diagnosed at maybe in 2026, when you are screened, they say, no, you are free from glaucoma at this point. But you still remember at some point in my lifetime, you can still develop it. This chance increases as you age, so it is really important that even in 2026, you are free, 2027, you are free, 2030 you are free, but in 2035 you might be diagnosed of being a suspect, which is still safer than thinking that let me not be identified, let doctor not call that word close to me. If that glaucoma word is called, now I am doomed. No, that is not why we are here. If that is pronounced, you are at an advantage of keeping your sight with you. That is the essence of all these program and educational series. So that comes to the family history. Apart from the family history, we now go into other factors like eye pressure. High eye pressure is a risk factor for developing glaucoma. The normal eye pressure is between 10 and 21, but anything above than that is called, in the absence of other findings. You can have high eye pressure, but you can have a normal patient, but especially when we examine and the eye is not showing any sign of glaucomatous damage. You can maintain them. But once you have high eye pressure, you come under the radar of the eye doctors. You keep checking. That does not mean normal eye pressure does not give you glaucoma. There are variants in there. What is common in the African race is the primary open angle glaucoma. In that broad spectrum, you have the normal tension glaucoma or the low tension glaucoma. Low tension, normal pressure glaucoma, your pressure can be as low as 8. It can be as low as 10.
And you still have
it. So that is why you need the help of the doctor. Sometimes patients also go to, now there are centers where you can check eye pressure. Oh, my eye pressure is good. They just go. Okay, it is not true. Beware of what you are doing. It's just like checking my blood pressure. It is your doctor that will tell you this blood pressure is good for you or not. Your eye doctor checks the eye because he is not only checking the eye, he is looking into the optic nerve head. That is the wire that sends all the impulses, whatever image we see, to the brain. He checks the health of it and tells you that place is not looking healthy or that place is looking suspicious. Okay, so eye pressure is an important risk factor for developing glaucoma. Then the anatomy of the eye. Sometimes you have the central corneal thickness. The cornea is the transparent, clear glass-like structure that covers the eye, outer part of the eye at the front. We call it the anterior part. And for some reason, some people have very thin corneas. Some people have very thick corneas. Those that have thin corneas are at risk of developing glaucoma. When you have thin cornea, you might be having a falsely low eye pressure. You can measure your eye pressure, but the eye pressure might be reading 7, 8. But when there is a correction factor that will be added, now when you add the correction factor, that pressure can shoot up to 16, 17. So these are the reasons we tell the patients to come to the hospital, because the eye doctor understands the little details that go with it. Then the eye doctor also assesses your eye and check the optic nerve head, the wire that supplies all these visual impulses, and see whether it is a healthy nerve, whether it is not a healthy nerve. If it is a healthy nerve, he will make it clear to you it is healthy. If it is not looking healthy, he will tell you. If for any reason there is suspicion in that area, he will still tell you and place you as a suspect. So these are some of the reasons you are going to for a screening from the eye doctors. Then there are other systemic conditions like diabetes. When you have diabetes is an independent risk factor for many things, and glaucoma is one of them. Then those that are having blood pressure related issues, vascular causes. Okay, some people have low eye pressure. And low eye pressure, especially if you have low eye pressure at night, you are predisposed to normal pressure glaucoma. And then those that are hypertensive and you take blood pressure medications and your blood pressure drops, especially in the night, or sometimes they take some medication because the blood pressure is not controlled well. Nighttime drugs, they tend to have drop in blood flow to the eye, and it drops the eye pressure badly. And when the eye is not sufficiently supplied with blood, then you have what we call ocular perfusion. You now come down with your eye pressures. This time might be low, but you might be having damaging things in the eye. These are the causes of low eye pressure glaucoma or normal tension glaucoma, which sometimes can be more damaging than the high pressure glaucoma, because it is more technical to manage and not easily picked. And those that have extremities like your hands and your legs that are cold, okay, for some reason your hands and legs are cold, we call it's a vascular problem, because blood doesn't flow very well to the legs, hand. We call it the Raynaud phenomenon, and because of that, a similar thing will be going on in the eye. The ocular perfusion, blood flow to the eye, might be affected, and because of that, they might have normal tension glaucoma. And those that have migraines are at risk of developing glaucoma. Those are that have migraine headaches of unknown origin, and your doctor diagnosed it to be migraine. These are people that can develop glaucoma. Then other risk factors like those, we call it sleep apnea. Sleep apnea means you are sleeping, but there is some kind of shortness of breath or cutting of breath. Let me put it in the local understandable. Your breathing somehow stop abruptly while you are sleeping, and it is quite common among people that snore badly. Okay, so these are things one has to be familiar with. And if you know you are a snorer, if your spouse or somebody who sleeps by your side tells you it seems your breathing stops at some point and you bounce back, these are individuals who are at risk of developing glaucoma. Then some other factors like use of medication, especially the steroids. Okay, the steroids, it must not be only eye drops. It can be in form of tablets, it can be in form of creams, it can be inhalational. Why I said inhalational is there are a lot of patients who are using asthmatic medication. Okay, it's not all asthmatic medication that are steroid. Sometimes when the asthma is poorly controlled or uncontrollable, the doctor has to switch to steroid medication, and some people have that severe asthma, so there are steroid inhalers they use. So those are also at risk of developing glaucoma. If you have a child, adult using inhalers like seretide inhalers, not Ventolin inhaler. Ventolin inhaler is purely salbutamol, so you don't have a problem. Seretide has a steroid component to it, so you need to know that. Then those that have skin problem, and some skin problem also warrant the need of steroids. So you are using these medications for a long time, please, you must see your doctors. Okay, then those that are on transplant, those that have significant renal disease or something, and for some reason, or autoimmune disease, and your doctors have prescribed steroids for long-term use, for some reason some amount of steroids are used in some patient for a long term, you must go and have your eye checked. Steroids, apart from causing glaucoma, they can cause other problems in the eye, so it is important to know that. And then for those simple eye problem like red eye, and so many of our patients go across counter, go to the chemist and buy eye drops. Chemists usually don't know the implications of what they give. They easily give steroid because steroids actually make your eye to be clear in one day, which the eye doctor will be worried doing, because it does the work like this. They are used to giving it. And then the patient, the next time when he has redness, because it keeps happening as the weather changes, he goes to buy the same medication, not even from the chemist, just go and show the bottle and collect it and start using it. When you use that eye drop that way, you are going to have high eye pressure developing. These are, and it is common among the blacks, these are called the steroid responders. Your eye pressure will be 10. By the time you use that eye drop, your eye pressure will go to 50. And when the 50 is not noticed immediately, it will take away your sight. Sometimes patients who have had surgeries, small surgeries, big surgeries, you are tired of following up with the doctor, you discontinue and say this drug is working well, you keep taking it, and then they come down with high eye pressure. So for some reason, if there is a follow-up, go for follow-up. If you think you cannot go for a follow-up after surgery, let the doctor know that you cannot be coming for follow-up, that please can I be placed on a long-term medication. Then the doctor will be careful. He will not give you any steroid. Steroids are beautiful drugs, but they are very dangerous, very harmful. Whichever route you are using, they can be harmful too. So it is good to know that.
Can you help some people understand what is steroid?
Steroids are some medications, okay, that are used when you have significant inflammation in the body. It can happen in eye, it can happen in any part of the eye. They are the parent is cholesterol, but the beautiful thing about steroids, they seem to mop up harmful effect of many of the medication. On a short term, they do a lot of beautiful work, but on the long run, if you use it without prescription, you might run into some difficulties. Nigeria is not a regulated country. Outside, these are not OTC medication, that is over-the-counter medications at all, because you cannot run into this kind of problem. But because of our peculiar circumstance in this country, you can buy everything and everybody can use everything. Nigeria is a cocktail nation. So that is the challenge with steroid medication. So by a word of advice, don't just buy drugs without proper prescription. It can be harmful to you. And everything good cannot be sweet that way. It has its. Then other things that can give you risk factors are if you have previous history of an eye surgery, injury to the eye, injury or traumas to the eye, any manipulation inside the eye, or any eye condition like inflammation that has lasted for long time. These are all conditions that can give you glaucoma in the long run. Or a cataract that the patient says, I don't want to remove it, and it stays. Cataract causes reversible blindness, but for some reason somebody is afraid of taking it off with the help of surgery. It stays for a long time. It now becomes glaucomatous. It becomes phacomorphic glaucoma. Such glaucomas are also difficult to treat. Okay, so it's good to know the difference. So there are so many things that can cause glaucoma, so a periodic evaluation is very important.
Okay, we'll go for a short commercial break. Dr. Sohanya has reeled out a lot of conditions that predisposes you to glaucoma. If any of them was mentioned and it affects you, then it's important that you go for an eye checkup. Okay, I know someone who suffers apnea. Okay, so the breath cuts for about 30 seconds or 1 minute, and then they continue sleeping. Actually, it has even been said that sometimes that's what causes some people dying, from sleep. Okay, so the talk lines will be getting open in just a moment, and I'd like you to ask questions. Okay, don't just keep quiet. Sometimes we feel that if we keep quiet, it means that it will go away. No, it doesn't go away. There's an adage, an Igbo adage that says "Ikem kucha aborojo." Taking precaution is not fear. Okay, checking is not fear. Go there, check it, and then you can start treatment. It's time to have an interaction with you. If you have a question you want to ask, remember we're talking about something that stays with you for a very long time. And one of the things we need to get rid of is our belief in myths and superstition. If you have a question for Dr. Sohanya, this is the time to bring it. And some of you wait until we are almost out of the studio before you can ask your questions or share your concerns. 0909 771 1009, 0704 5502 840. You can also try 080 5511 5333, 080 5511 5333. Okay. Does wearing glasses prevent glaucoma? Sorry about that.
Thank you. Wearing glasses does not prevent glaucoma. I think that takes me to one point I forgot to mention. Some refractive errors, like somebody who is short-sighted is at a higher risk of developing glaucoma. Okay?
Let's take this call.
Okay.
Calls are expensive now. Hello?
Hello, good morning.
Yeah, good morning. What's your name and where are you calling from?
I'm Azumi. I'm calling from the local.
All right, go ahead. We're listening to you.
Yeah, no, please, I think I am diagnosed of this but what I do is that I normally go for to by the doctor. And also for 1 year now, let's say for 1 year now, I've been taking on drugs that are constant. The doctor tells me that every and the drugs are vicious. Let that. And there is a glaucoma. And in most cases, when you get depression, that one they use to cut the eye, and the one that is like the eye spot. After using it, you tell me my pressure is getting okay. And like, can you jump?
Are you getting what he's saying? All right, just relax. Hello, sir. You're loud, but you're not clear. We need to get what you're saying. Take it easy so that she can get what you're saying.
What I'm saying is that I have a hospital I attend.
Okay.
And they have been placed on at least a drug for this year now. By the 3 times I've visited the hospital for 2 months. And they asked me to continue with the drug.
Okay.
Result 1, glaucoma, 2, 2. And then after going for the appointment, you check the injection from after brushing the eye in that machine and using the touch and all the rest of it. You tell me that the breast infection is getting okay. And then in most cases, you ask for tablets. And they say that tablets do not last 3 to 7 days. But are the ones that are used to a person and you finish. But if you look at me on this particular drug and this eye drug, I said no.
Okay. All right. You got a bit of what to say.
I didn't get what he said. He have something.
I think he said he has been diagnosed.
Okay.
And then they placed him on certain medication. But what exactly he's asking, I didn't get it. All right. You might want to call back and let us know what you really. Okay, keep the calls coming. 080 5511 5333. Okay, 080 5511 5333. We have limited time. The man who called, I don't know if you can send a text message to that number, it will also help. Hello, good morning.
Good morning, sir.
Good morning.
My name is Uzo.
Also, you're welcome. Go ahead. Where are you calling from?
I'm calling from Uzo in Delta State.
Delta State.
Yes, sir.
All right, go ahead and ask your question.
Yes, sir. I am 85 years.
Wow.
And when I was about
Go ahead.
69, I went for an operation at University of Lagos at Leeds. It was a cataract, he called it.
Okay.
But when I came out of the patient, one eye started giving trouble, which was the left one. The right one, I just don't understand. I don't know if I can get your address. Maybe it will be better to visit you.
Okay. So, what exactly is the problem right now?
The problem right now is that my left eye hardly sees at all.
Okay, hardly sees at all.
Yes, but the right one, I monitor. I can cross road, I can even read papers and so on.
Okay.
But I know it is not okay.
Okay. So, you don't see at all with the left one?
That's right, sir.
Okay. Okay. And you had a cataract surgery?
I had cataract surgery.
Okay. How long ago?
That was 2009.
2009. Okay.
Yes, sir.
Okay, Doc, over to you. Just keep listening.
I think you have had a cataract surgery. I don't know whether it is the right or left eye, so I wouldn't know what led to the poor vision in your left eye. But as it is, you have one eye you are working with. So it is imperative that you are followed up properly so that you keep seeing with that eye. It is very, very important that a check is done properly and you are followed up properly. So go to the nearest hospital, eye hospital, please, so that you can have the eye checked by the eye doctors.
Okay, and if you can call back, we want to know whether is the eye that was operated that
went blind.
That went blind. Okay. Hello. Good morning.
Good morning.
Good morning.
I'm okay to say many about.
Okay, go ahead.
Because I wasn't sure that good morning.
Morning, sir.
Get that call in. Okay, 08055115333. 08055115333. You were going to answer a question. You were answering a question about eyeglass, but let me take this one. Hello?
Hello?
Yeah, good morning.
Good morning, you see the entry.
Yeah, what's your name?
This is Chief 14 from Nightmare.
You're welcome. Go ahead, quickly, we're almost out
I
of
want
time.
to ask if there is any food that somebody will avoid so that it is not like glaucoma.
Okay.
Or
Have you gone for a check before?
no.
Okay, do that as fast as you can because that's where to start. Okay, let me get the last call and then we're done for today. Okay, so you can be answering the question while
Mr. Wan, for you ask about what food to avoid, I can advise you. Abacha is not particularly friendly with the eye. I didn't say don't eat it at all, but abacha contains cyanide. Cyanide causes some damage to the optic nerve. That is the nerve that help you to see. So it can, in the long run, if you are eating it frequently, in the long run it will affect the eye. So it is important to avoid that. Apart from that, you also avoid smoking, drinking. These are all things you have to avoid. You can safely engage in eating a lot of fruits and vegetables, especially leafy green vegetable, colored fruits, bright colored fruits. Okay, that's if you are not diabetic. If you are diabetic, avoid fruits, take a lot of veggies.
Okay, every day we hear new things. Okay, so we should avoid fruits if you're diabetic.
If you are diabetic, there is a portion, the fruits are very reduced. You don't eat so much of pawpaw, you don't eat so much of banana, you take a bite of it and all that, a slice
more
of
of veggies.
So to be on the safe side, you can deal with vegetables, things like carrot, you can eat cucumber, you can eat ube, you can eat a green, all the greens have a lot of antioxidants. They are food substance that can go and mop up what we call the free radicals. The free radicals are chemicals that damage the optic nerve. So it is important to take a lot of salad, things that are in form of fresh fruits and veggies. It's very important.
Okay, closing remarks. Our time is up.
So if you are at least know that we are all at risk of developing glaucoma by the virtue that we are all blacks living here. Even if we say we are not Igbos, we are all blacks. So it is on us to go and present our eyes, if you love ourselves, so that we keep preserving this eye, that help you to keep your life in an independent way, so that you can keep working and at least moving around on your own. Even if you are old and tired, you want to see things, you want to see your loved ones, you want to read a book. Your eyes are very important to you. I don't need to say it. All of us know eyes are important. So take a little time of yours, just one day out in a year, in a 365-day cycle. Go to an eye hospital, check your eye, and do the needful.
Thank you, Dr. Sohanya Keke. It's always fun.
You.
And thank you, all of you that listened out there. And take care of your eyes.